Live at 9 wants to be part of the conversation about mental health and raise awareness about the important role this plays in everyone's overall well-being. And this morning, we are kicking off Mental Health Mondays for National Mental Health Awareness Month. Edward Woody is the Chief Operating Officer of Lakeside Behavioral Health. He's also a veteran and is here today to talk about the mental health challenges that veterans and military families face. Now, we were chatting. You have quite an extensive background in this area. Can you just tell us about that?
Yes. I started out as a medical service corps officer in the United States Army. Actually, I graduated from Memphis State University.
Yeah, Memphis State. Somebody dated themselves. Yeah. Mm-hmm.
Go Tigers. And got an opportunity to go on active duty. Did 20 years. Met my beautiful wife. In Korea, and I had an opportunity to serve for the VA hospital in 4 different locations. Enjoyed it. Got to give back to a real small population. Only about 6% of the nation are veterans.
But they're the people who protect and serve our whole country. So if you could speak to you being on the front lines there, seeing, being in a medical facility on the front lines, what are the challenges that our military face?
Well, it's a couple of things. It's the transition coming back from deployment. One of the things that happens so often in deployments is you have the family going on with life while the service member is gone. They take on new responsibilities, new roles, and then when the service member comes back, he has to reintegrate him or herself into those roles. Things have changed. You've missed important things like birthdays and parties and first dates, and it's really hard on that individual service member.
Wow, okay, and so then there's the whole family itself with the people, so you're trying to get back into the infrastructure of life, and then your relationships change as everyone evolves.
Yes, and then a lot of the children have the same issues, but the parents are really dealing with those things because you've been away, you've missed those things, as I said, but more importantly, you've seen things that in combat zones that come back with you.
Right.
You come back focused on reintegrating, but you're still dealing with things that may have happened. Some of the traumatic events that you saw make that new homecoming difficult sometimes.
Yeah, because I guess things would trigger that, right? And it would surface as you're living, and all of a sudden you're like, wait a minute, I went through this, and then you're trying to process that, but then there are other people who are there with you.
Correct. And you have your friends, your comrades. It's a family, and things happen to some of those individuals, and you bring those things back. It's almost like a sorority or a fraternity.
Right.
There is a bond that you have, and sometimes it's really hard to bring those individuals back to the States with you. You leave a lot of things there, and you try to compartmentalize it in some cases.
I know that, we have in Millington, we have the base there. So there are a lot of people in our area that are facing this. As a veteran yourself, why is this important? Mental health has now become something that people talk about. Why is it important to make this part of the conversation?
It's critically important because, as I said, 6% of the population is veterans. Those individuals have suffered. And what they're doing now, there are about 22 suicides a day.
Whoa.
And so
with among the military alone?
Veterans, yes.
Really?
Veterans,
and this is people who've come home or out in the...
Come home and are dealing with it. So it's really critically important that we understand what's going on with them, try to give them the services that they need. We have a new program called the Compact Act. And it's designed to provide care on an emergent basis for any service member who served honorably. You can get up to 30 days of care in an inpatient setting and 90 days on an outpatient
At Lakeside.
At any hospital.
At any hospital, yes. Okay. And what is the Patriot Support Program? So are these two different things?
Yes, so the Patriot Support Unit is a unit we have at Lakeside. It's about a 24-bed unit that is specifically designed for veterans. And we utilize that unit to have veterans on it, and everyone is really focused on taking care of the veteran, but there's that camaraderie there. So people who walk the same ground as you have, and you get better because of that. And it's a really good opportunity for us to give back to the community.
I feel like you were telling more about the 30 days, and I kind of thought it was the same thing. So these are two different things.
Yes.
How do people plug into the 30-day service?
So if you are a veteran and you're in crisis, we don't want any cost to be a barrier to getting the services you need. So you can report to any emergency room at a local hospital or a VA hospital and get the care. And it'll be paid for. And on the outpatient side, once you get out of the hospital, there's a 90-day care that's provided as well.
Okay, what is the one thing that you would like to share this Mental Health Awareness Month with your comrades, other military veterans and their families, just to ponder?
When you reach out to someone, you don't know what they're going through. There's a book called Touch Points. A 15-second conversation can really bring a lot. So if you know a veteran and you know someone who has served, reach out to them and ask that question, how are you doing? And ask that question earnestly and wait for an answer and try to help as you can.
Ed, thank you so much for really bringing this to the forefront, helping us understand this.
Thank you.